bartender. Hey, set 'em up again, and I know what it looks like. Things aren't what they seem. I'm not a fool. I just play one on Jim Beam. Off a bottle, an evil genie casts a spell, makes me throw on.
You said non-placebo controlled. What do you mean?
I mean that essentially what Peter does, and I'm not criticizing him because obviously it is very difficult to do, but he doesn't have randomly vaccinated or children who randomly receive pertussis vaccine or don't receive pertussis vaccine. What he has is he follows children who have received this or that or the other vaccine and tries to draw conclusions from what he sees.
Okay. Is 5 days long enough to detect adverse reactions that occur after 5 days?
No, they would be reported separately as observed in the clinic.
In section 6.1 of the manufacturer insert, which under the Code of Federal Regulations they're supposed to describe the clinical trial, does it provide for anything other than 5 days of monitoring after each dose for adverse events?
It does not specifically say that, no.
There is no control group, correct?
Let's see. Well, they mention 3,258 doses were administered to 1,252 healthy adults.
That's right. But does it mention any control group, Dr. Plotkin?
It does not mention any control group, no.
Okay. So let's take a look at Endurex B. That's the other hepatitis B vaccine that you're testified you recommend faith to proceed. Can you please tell me how long the safety review period was in the pre-licensure clinical trials after each dose?
All subjects were monitored for 4 days post-administration. That does not necessarily mean that they didn't collect reactions after 4 days.
Are you claiming they collected reactions after 4 days, but didn't disclose it here in violation of the Code of Federal Regulations?
I dare say that they collected putative reactions for a longer period. I feel quite positive about that. When they say they were monitored for 4 days, that means active monitoring as opposed to collecting reports later on. That is not uncommon in clinical trials.
Can you provide any proof that there was any reports or follow-up after those 4 days?
Well, it doesn't say that here, but I am willing to bet that they did collect reactions after 4 days. And I imagine that the FDA would not have allowed them not to do that.
But as you sit here today, that's just speculation, correct?
Yes, that's speculation based on experience.
But to know whether or not these are actually caused by Endurex B, again, you would need a properly randomized placebo-controlled study, correct?
Correct.
Okay. But this study wasn't done pre-licensure for this vaccine, right?
I'd have to go back and look at the original studies, but these data undoubtedly refer not only to the study that was done before licensure, but also to phenomena reported after licensure.
He was efficacy of the vaccine was followed up for at least 12 months, for 18 months, but safety was only done for 4 or 5 days.
I do not agree with that statement.
Okay.
I do believe that GSK, like any other company, would have followed their patients much longer than 4 days and would have collected reaction data.
And if they didn't do that, you would agree that that is completely inadequate in terms of assessing safety pre-licensure?
I would say that would be inadequate, yes.
How long was the safety review for each dose of IPOL in the preclinical trials for that vaccine?
I do not know offhand, but Counselor, IPV has been used throughout the world for years in millions of people, and safety data have been collected on many such studies, and essentially serious reactions to IPV are extremely rare. So IPV is a very safe vaccine. That goes back to Jonas Salk, where where millions of children actually were vaccinated with IPV back in the 50s.
And is there a clinical trial data on safety?
Yes,
Okay, and is that the same vaccine that's used today?
yes.
Are you prepared to produce that clinical data? Yeah.
Those data are in this book. And I'll be glad to provide you with the references if you really insist. But IPV, as I've said, has been used in millions and millions of people.
If it's so safe, then how come the safety review period for the pre-licensure clinical trial as provided in the manufacturer insert for IPOL only reviewed safety for 48 hours?
Once again, I have no doubt that safety observations were made after 48 hours, but they expected that immediate reactions such as a sore arm or fainting or something like that would have happened within 48 hours.
Preserve the objection. To my understanding, Dr. Plotkin had no role in the study design. You're asking to speculate as to the reasoning of other people that he had no contact with.
Okay. He's testifying that my client should receive this vaccine. I could certainly ask him about the pre-licensure clinical trials that were done to assess its safety. And you put him up as an expert in vaccinology. But your objection is noted and preserved for the record. Thank you, Counselor. Do you know how long the safety review period for each dose of MMR in the pre-licensure clinical trial was for this vaccine?
Not offhand. The vaccine has only been used now for about 50 years.
Okay. So it's more recent, right? What you'll find is that there was no clinical trial prior to licensure for MMR, correct?
I doubt very much that's the case.
Are you aware that it is a grandfathered product?
I am not aware that it's grandfathered. I was alive and well when the product was first licensed, and it was tested extensively before it was licensed.
But right now, I'm trying to talk to you about the pre-licensure clinical safety.
And what I'm telling you is that millions of doses have been used of this vaccine.
I understand you want
and that there was pre-licensure trials,
okay,
which I am absolutely confident about.
Okay.
And you're talking about stuff that's in a package circular that the FDA has approved in full knowledge that safety and efficacy have been demonstrated.
So you're saying there were clinical trials before the MMR was licensed?
Absolutely.
Okay, and you can provide those?
You can find them in this book if you wish.
So you're saying you won't provide them?
I'm well. Yes, I guess I am saying I won't provide them. If you want to take the trouble, read the book.
Okay, so sitting here today, when did these? Can you tell me what year these clinical trials occurred?
Yes, they were done in the 1960s and the mainly in the 1960s.
So you're claiming something happened, but you're not willing to provide any proof that it happened.
The proof is in the publications, which you
Okay,
can
you
read.
please turn to the
if you
page
like.
where it's in there?
Between pages 592 and 600, including tables that show the antibody responses, proportion of children with fever and rash after measles vaccine, etc., and the numerous references which go with this chapter.
So are you saying that that was a pre-licensure clinical trial?
Yes.
That you just read from?
Yes, but again, I insist that pre-licensure or post-licensure, the fact remains that the vaccine has been studied extensively over a period of 50 years.
I understand you want us to just take your word for it, but I prefer to rely on science, peer-reviewed publications.
That's
and
what you'll
clinical
find
trials.
in there.
And so, I understand that you're getting a little upset about me trying to ask for the data, but I'm just trying to get to the substance. The FDA it requires that clinical trials be on the insert. They're not here. Okay. This would have been post-licensure, not pre-licensure, and it doesn't indicate a placebo group, nor that it was. So this is not a clinical trial as far as I can tell. So are you saying that that was a pre-licensure clinical trial?
Yes.
That you just read from?
Yes, when the rubella vaccine that I developed was incorporated into MMR, obviously clinical trials were done before licensure, and I'm absolutely certain about that.
Well, maybe they're not included because they didn't include a placebo group. So
they
were not
may
considered.
not have included placebo groups.
So
yes.
maybe they weren't deemed valid and enough to consider a clinical trial.
That's absolutely false.
You said non-placebo controlled. What do you mean?
I mean that essentially what Peter does, and I'm not criticizing him because obviously it is very difficult to do, but he doesn't have randomly vaccinated or children who randomly receive pertussis vaccine or don't receive pertussis vaccine. What he has is he follows children who have received this or that or the other vaccine and tries to draw conclusions from what he sees.
It exists. You told me that it's in this chapter, and you assured me it's in there, but you're not citing to anything in there right now. So I'm happy to get a copy from you if you'd like to provide it after this deposition. Would you like to do that?
I will look.
Okay.
Generally speaking, studies organized by manufacturers or anybody else for that matter of vaccines has a safety board attached to the study, and they evaluate whether they think the reaction was due to the vaccine or not. And what this says is that only one of those events was attributed to the vaccine.
That's right. That's exactly what this says. What
yes.
And you told me that the people that evaluate that is a board set up by the company, the pharmaceutical company seeking approval, correct?
Yes, they set up the board and they choose individuals who are not employees of the company.
But they choose the individuals, correct?
They choose the individuals, okay. Yes.
In your experience, Dr. Plotkin, in any given 30-day period, do 3.4% of children in this country experience a serious adverse event?
Yes, that's quite possible.
Okay. So 3.4% every month, that would mean within 3 years, every child in this country would experience a serious adverse event, correct?
Yes,
That's
correct.
Right. Okay.
But you have to understand that serious adverse events mean, for example, that a child develops a respiratory infection during the period of the trial. And then the question is, could that respiratory infection be attributed to the vaccine? And the board decides whether or not it's likely that a vaccine could cause a respiratory infection 2 or 3 weeks after the vaccination, for example.
This is the manufacturer insert for Gardasil, correct? Which is a vaccine against HPV.
Yes.
That means 2.3% of the girls and women in the clinical trial during a 6-month period had an incident that indicated a systemic autoimmune disorder, correct?
Yes.
Okay. Why combine the autoimmunity rate in the aluminum adjuvant control with the autoimmunity rate in the saline placebo? Why not break those out to show them separately?
And they wanted to be sure that the reactions that they were seeing were not caused by the adjuvant, or that they were specific to the HPV antigens themselves and not to the adjuvant. So I judge that's why they did that.
Well, under that logic, then they certainly should have broken out the aluminum control from the saline placebo control and showed them in 2 separate columns on page 8, correct?
They probably should have, yes.
So that you could see the difference in autoimmune rate between the individuals receiving the aluminum and the saline placebo, correct?
Yes.
Okay. But they chose to conveniently combine it when it came to systemic autoimmune disorders, right?
I guess they believed that aluminum in itself is a reasonable control and would not cause autoimmunity.
Okay, so going into this study, they just assumed aluminum wouldn't cause autoimmunity, and so that's how they proceed in designing it. I got it. All right.
I'm not a fool, I just play one on the Jim Beam.